And now it's time for Family Health Matters with your host, Miss Wendy Bridgers, First Lady, RN. She is a registered nurse for over 35 years, and she has graduated from North Carolina Central University and has received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born again child of the Most High King.
Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are live in our studio today on Awesome Radio 106.9 FM. We are here every Thursday from 3 to 3:30. We invite you to join us so that you can hear good, healthy tips and facts on how we can stay healthy because we here at Family Health Matters do believe that the health of our families do matter. And I welcome you today to be with us while we talk about something that um, we all should be doing, but we want to do even more. So we're excited to have again with us in the studio Angie Watson from our local health department. Angie is a licensed or registered dietitian, and she has a specialty in diabetes educate as a diabetes educator. So, Angie, welcome again to Family Health Matters. So glad you could be with us on today.
Thank you so much, Wendy. I'm happy to be here.
Thank you, thank you, thank you. We look forward to you being with us every day because you always bring every Thursday when you come on. You always bring good ideas, helpful tips, and amazing recipes, and a lot of education for our viewers. So today we're going to be talking about moving more, and why do we need to move? And I know everybody says, exercise, exercise, exercise. Yes, we talk about dieting and we make all of our plans and set our goals, but we need to enhance our eating healthy with some moving and moving more. So we're going to be focusing on ways that we can move more, the benefits, and then setting some plans that will be effective for us, not the whole community, but something that will work for us. So, all right, Angie, we're going to jump right into our topic and talking about moving more. So, tell us a little bit about the benefits of just moving more. And we're not going to say exercise. We're going to just say moving more because I think exercise
Yes,
intimidate people. And you think about an exercise program, you think about going to the gym, you think about running. And so we're going to talk about moving more. So tell us the benefits of what for our bodies as far as moving more is concerned.
yes, there are so many benefits. I will say is for some, exercise or moving more comes easy, but for most of us, it doesn't really come easy. We have to make a conscious effort. And really, I like the title Moving More because you want to start with where you're at and increase it. And we'll talk about that today. But just some of the benefits to increasing that physical activity are lower cholesterol, lower blood pressure, lower blood sugar, reducing stress and anxiety, improved mood, also increased energy, improving our sleep, and a lower risk of certain cancers. So as far as the chronic diseases that plague our health, you're looking at heart disease, diabetes, hypertension, high blood pressure, some cancers that physical activity, incorporating that on a regular basis has a role to play in helping to prevent or control these conditions. So that's huge.
Yes, yes, that is huge. That is huge. So, can you just tell us a little bit about just the? I know with the moving more, we will decrease our weight. Hopefully, with that, just a little bit of increase in our movement, and that, as you said earlier, will have an effect on chronic medical conditions that we may have, like hypertension and diabetes. Just with that activity, can help improve those things. Correct?
That's right. One thing that you may not know, I always caution people because people think that if I just exercise, I'll lose weight. There have been some studies done. Our lifestyle changes. It's such a psychological thing with our brain Sometimes we trick ourselves. So a lot of people think that when they exercise, they think that they burn way more calories than they actually do. So if you've ever, been on a treadmill at the gym and you walk for 30 minutes, or even I run for 30 minutes and it says you burned 100 calories. And I'm like, that's a banana. That's not even a whole candy bar that I just burned. And so they've actually found that people tend to, when they increase their exercise, they increase their eating because they think they have that wiggle room. And so I do want to caution, exercise definitely helps with weight loss, but cautioning folks, if you're adding in that exercise, be sure that you're eating the same. For the average person doing physical activity, you don't need to increase your diet unless you're, an Olympic athlete or a marathon runner or something like that. Really, your food intake should stay the same.
Yeah, because you're almost defeating your purpose, because those calories sort of balance off with the weight loss. And, people say they count calories, but yeah, you need to be conscious of the calories, because if you're burning calories, but you're still, as you said, taking in more calories than you're burning, then you're not balancing at all. You can increase your weight with that thinking, with that thought. And I know with, even with activity, improving your sleep, it just mentally helps you relax and help your think process. And when you're ready to go to bed, it sort of decreases the amount of energy that you're burning, so that you can sort of calm down and relax a little bit. And also, think you mentioned about stress management. It helps moving more, just getting out, getting the fresh air. It actually helps you with just relieving stress. And you've had a busy day at work, and you come home and you take a stroll, you take a walk. It sort of helps your mind to relax and sort of gather your thoughts.
Exactly. And, sometimes it's hard to push ourselves to do that. When you're stressed and busy, you feel tired, so for some of us, the last thing you want to do is go for a walk or, be more active. When we feel tired, we just want to lay on the couch. But it really does decrease that stress and anxiety. And also I mentioned increased energy. So, a lot of people say, well, I get tired when I exercise. Well, in the moment or, immediately after, yes, if you're moving and active, it's normal to, get fatigued some. But studies show that in general, when folks are active on a regular basis, that overall they have increased energy. And I've seen that even with myself, because I go through slumps where I'm not as active and I just feel more, sluggish, just kind of low on energy. Compared to when you do exercise regularly.
Yeah. And I think that key, you said regularly, because your body gets in a mode of realizing that this has become part of my routine, and it looks for that. And it looks for that part to be there. And I know people ask the question, is it better to exercise in the morning, or, well, I won't say exercise, move more in the morning, or take a stroll in the morning versus taking a stroll in the afternoon? What are your thoughts on that?
Mm-hmm. So I've read some research as far as that also. The best time to incorporate activity, and I keep using the E word, the exercise word, I'm going to try not to use that. But the best time to incorporate is really the time that works best for the individual. So if you are a morning person, exercising in the morning is wonderful. There is an advantage of exercising in the morning, and that is that nothing kind of bumps that planned activity off your schedule. If that's the first thing or pretty much the first thing you're doing in your day, there's generally nothing that will interfere with that. But let's say you plan to be active at the end of the day, go for a walk or go to the gym, and then something comes up during the day. One of your family members needs you, or, you're going to church or whatever it might be. There can be things that impact those plans. But still, if someone just isn't a morning person, having a plan to, okay, I'm going to get up extra early. I'm going to get up at 5 a.m. and I'm going to, move and push my body. It may not be realistic for that person. Right. So you have to do what works best for you. Sometimes we already have to push ourselves beyond. And so if you have the addition of, okay, I'm not a morning person, I'm having to push through that, it may not be as likely to succeed.
Just to do it. So the idea is to get it in, regardless of whether it's in the morning time or whether or not it's in the afternoon or whether it's in the middle of the day, is to get those extra, excuse me, to get those movement times in.
That's right. That's right.
Great.
And along with that, one thing that can help is actually adding it to your schedule.
Mm.
If you keep a calendar, actually putting it on your calendar, whether it's a calendar on your cell phone or a paper calendar, writing in the time or times that you're going to be active, and sticking to that, that can really help.
And that's just, I think I like that about putting it as part of your plan, because a lot of us do schedules and we do have our calendar. And the events that we place in that calendar are events that we can go in and check off and say, we did this, we accomplished this, and those goals that we did. And adding that as far as a goal or an activity or a meeting is to, that will put that just as important as it is for you to plan to, go to your doctor's appointment, and you have
Exactly.
that time scheduled. And so that to me says that it is just as important to get up and move as it is to meet that doctor's appointment. And so that in my mind says, okay, if I made it that important that I have actually written it down, then I need to get up and do it.
Yeah, that's right. That's right.
Okay. So the question two comes along is, how much is enough? I know we've said we want to move, we want to get up, and we want to start doing a little bit more activity, but how much is enough, and how much is too much, and how much is not enough?
Right. So that's a loaded question. The Department of Health and Human Services, or DHHS, with the federal government, they do set guidelines as far as how much physical activity the average adult should get for optimal health. And so those guidelines, basically 150 minutes a week is the key to remember. The goal, I'll say eventual goal, is to work up to incorporating up to 150 minutes a week of movement, things that, get your heart and lungs going. That's what they call cardiovascular or aerobic activity. They also recommend strengthening activities a couple of days a week. But to be honest, like even as a health educator, a diabetes educator, we always start with where people are at. For some folks, that 150 minutes a week is overwhelming. For others, it's not. So if we break it down, that would be 30 minutes, 5 days a week. So for some people, that's very reasonable and doable with their schedules, with their fitness level. And for others, it's really not at all. So then just starting with where you're at, and any movement is better than none. But I do like to tell folks about that 150 minutes because that shows how important it is, and that the more we can do, the better. So even if we don't get to that, if we're striving for more and more, that's going to benefit our health.
Great. That's great. So, because like you said, 150 minutes can be overwhelming. So you mentioned, 30 minutes, what, 3 or 4 times a week.
But
So what if you can't do 30 minutes? Is it just as effective to break it up into 15 minutes, maybe 15 minutes in the morning and 15 minutes in the afternoon versus
yes,
not doing anything?
yep, for sure. And so, yes, so again, the goal was 30 minutes, 5 days a week, or however you wanted to break it up, but trying to get to that total of 150. But yes, those 30 minutes can be broken up. You don't want to break them up into anything smaller than 10-minute increments. So the research has shown that you need at least 10 minutes of that sustained kind of aerobic activity, your heart's beating a little faster to truly get that benefit. Now, just moving more steps in general help us and they're good for our health, but they don't necessarily benefit our heart to that extent. So yes, you could break it up into 10-minute segments 3 times a day, or 15 minutes twice a day, that kind of thing.
Okay. I like that because, the difference between, you mentioned earlier, cardiovascular and strengthening. So if we're going to do cardiovascular, we want to get our heart rates up. Excuse me. And get the heart rate faster than what you would normally at a being settled and at a resting state. But for somebody who is not active, will have a sedentary lifestyle, this is going to be a new adventure for them, and they're going to make up in their mind that I'm going to start moving. but my normal day consists of me pretty much just being settled or sitting around. So maybe not getting my heart rate up that fast,
Exactly.
just a little bit, of just walking from, because I even have told people, just take the walk between commercials,
Hmm.
walk through your house. If you're not walking at all, walk through your house doing a commercial break. That increases a little bit and then gradually expand it to maybe not just walking in the house, but maybe walk to the mailbox,
Hmm.
because that may be as far as they can go at the beginning, but as
Exactly.
they continue to encourage that and incorporate it in their life, then gradually the more um, receptive the body will become.
Yeah, that's a great point. And I think it is important though to acknowledge that people are in different places as far as their ability, their health conditions, even their age. Somebody who's 80 years old and has never exercised, they're going to need to start really, really small, really slow. And so even if it's like I have some clients that the goal might be I'm going to exercise for 5 minutes 3 days a week, and that's what we start with. And we've talked about SMART goals before on the program, but the key is setting something that's attainable. We so many times with lifestyle changes, we set goals that are not necessarily attainable and realistic. They're way up here, like 150 minutes a week when we haven't done anything at all in the past, and then we get discouraged when we don't meet those. And
Yeah.
so, trying to set something that okay, I can do this. I just have to put it in my schedule or tell myself, make myself sort of move a little bit more, but I can accomplish it. And the more I accomplish it, the better I feel, and I can continue to increase after that.
Yeah, building on it. And I think one thing that we didn't mention, but I think I'll throw that in now, is that when you're looking at even just moving more, that you need to reach out to your primary care provider to make
Yes,
sure that your plans are something that's obtainable and something that's safe for you.
exactly. Yeah, that's a great point. So, and safety can be two factors. It could be cardiovascular wise, like with your heart. You don't want to put extra strain on your heart, especially if you're someone who maybe is a little bit older or has some chronic health conditions. And the other thing, I work a lot with older adults. So the other thing is our physical. Like one thing I'm thinking of is balance. Keeping our bones and everything healthy. The last thing you want is to have a fall and
Right.
be, debilitated to some degree, or, doing an activity that maybe puts a lot of pressure on your joints and you have joint pain or stretches a tendon or a ligament the wrong way. We never want to injure ourselves. So, yeah, that definitely talking with your doctor about what's safe for you and what's a good starting point is extremely important.
Absolutely. And that brings us to the next question I wanted to talk a little bit about is how do I know if I'm working hard enough or too hard? So that goes back to what we were talking about, making sure that we have communicated with our doctors or whoever our primary care provider is to make sure that we're doing things that's reasonable for us.
Yes.
And you want to make sure that you're avoiding any possibilities of a fall or anything like that. So
Hmm.
think about, how do I know if I'm working too hard or not
Yeah.
hard?
Yeah, that's a great question. Most of us don't have the problem of working too hard, but some of us do. Sometimes the problem is not working hard enough.
Yeah.
Sometimes you
I
focus
thought
on
I
a
put that
treadmill.
part in there though.
I know, that's great. But there's something really simple that can be done. It's called the talk test.
Uh-huh.
And what the talk test is, while you're being active, while you're, walking or, pushing the vacuum cleaner or whatever it is that you're doing to be active, try talking. And if you can easily have a conversation, kind of like we're doing now, then that is good, moderate activity. Now, if you never have to kind of pause and take a little extra breath, then you may not be working hard enough. And then on the flip side of that, if you can only get a few words out before you are gasping for air, then you're probably working a little bit too hard. There's also devices now that measure, heart rate, but that's a complicated thing, and everyone's heart rate runs differently, and it's, affected by age and that type of thing. So I had a client the other day ask me, well, what should my heart rate be? And I can't tell you that. Even your doctor may be able to tell you a goal, but it's very individual. So I wouldn't necessarily go by heart rate. The talk test is just a simple way of doing that.
Yeah. Then that's a good point, because if you are not active and you start being a little bit more, moving a little bit more, your heart rate can increase just that fast, because it's something that your body is not used to. And
Mm-hmm.
the more your body gets used to it, the more the heart will regulate and be more inclined to not
Exactly.
be hard,
Yep.
fast.
Yeah, exactly.
Yeah, so you don't want to totally depend on that. But I do like the test that if you can't breathe and you can't talk, then you need to slow down. But I think a good part too, Angie, to make it this point too, is that as you do it more often and move more, then that tolerance will get better. The
Exactly.
tolerance will increase to the point that you
Mm-hmm.
can do maybe that same speed walk or that same movement with
Yeah.
less stress. More
Exactly.
so
Yes.
just because you can't talk the first time doesn't mean that you need to stop and not do it again because you're
That's
afraid.
right.
That just means that your body is not used to it and
That's
it's
right.
saying, "Oh, what happened?"
Right. Right. And in those cases, it may be okay if I'm very short of breath. I feel like I'm working really hard. Then it may be okay. I'm going to do 5 minutes and then I'm going to stop. And then your goal is, as your body gets more conditioned to that activity, that you can increase that amount of time. Yeah, that's a great point.
Right, right. And that, and your body, and you need to
Mhm.
be aware of how different do you feel when you're doing those increasing the movement. And you don't want to go out there at the beginning and plan to walk 3 miles, because I always tell people, I said, you walk the miles, you got to remember you got to come back. So if you go 2 miles, you have to remember you got to come back 2 miles. So you got to keep that in mind, that when you're starting to increase your movement, wherever you go or whatever you do, you got to remember you got to come back to the starting point. So you have to think about that as you progress and set your smart goals.
Mhm. Yes. Yes.
Okay, so we talked about, knowing, that we can these exercises that we do. So you mentioned, again, mentioned this before about cardiovascular. So give us some ideas about what type of activities that we can do with
Mhm.
cardiovascular to increase our heart rate and also strengthen our muscles.
Mhm. Yeah, so those cardiovascular activities, we've been talking a lot about walking. So, walking or jogging, running, those are all considered good cardiovascular activities. Also, bicycling, swimming, different sports like group sports or playing tennis, dancing. I love to dance. And we also want to find ways to make exercise fun if we can. So, doing something that you enjoy, you're more likely to stick with it. And even things we do around the house, like yard work, if it's outside doing yard work, or inside doing housework. Now, I will say, I've had a few clients say, they spend time mowing, a couple hours mowing the lawn, and I ask them, do you have a ride-on mower? And oftentimes the answer is yes. Now, in their defense, they do say disclaimer, but I get off and pick up sticks, and that part is good, but that doesn't count for 2 hours of activity because a good majority of the time you're
They
riding.
tried.
So,
They tried.
I know. But those things really can count as activity. And there's some people who are very active doing, flower, like gardening in their yard, and yard work that's physically demanding, and those are great activities too. Um, so it doesn't necessarily have to be, okay, I'm going to go out for a walk or a bicycle or whatever. Again, just moving more. And then
And I think
strengthen.
before we leave the cardiovascular, one thing that I think you said earlier, that they need to be consistent. If
Yes.
you're gonna garden, garden and chop the grass a little bit and stop. You need to be sort
Right.
of consistent on a period of time, instead of just doing it for a little bit and stopping, sitting down, resting, and then start back again. Right?
Right. Right. That's right. That's right. So yeah, those ones are a little harder to quantify, you know, but thinking about if you're, you know, out, you know, gardening for 2 hours, how much of that time are you being active? You know, you're not sitting or you're not just, you know, kneeling. So, yeah, that's important. And then, you did mention too, strengthening exercises. So, again, some of this I'm saying is ideal. So ideally we would do strengthening exercises 2 days a week. Really, you know, we have this high bar of our goals, but again, just want to reiterate, if you're not currently active at all, then something is better than nothing. So I'm kind of giving you the gold standard, but, you know, think of that maybe long-term for yourself. So strengthening would be either using weights, like doing maybe some dumbbells at home or at the gym. That's another thing. A lot of people think they need to join a gym to exercise or be active, and you really don't. You can do activities at home. You can use your own body weight. You don't even necessarily need weights, like to do, like, say, dumbbell curls. You can use, I recommend like bags of beans or rice or something like that. They used to say use a can, and that's fine. But if you drop the can and it hits your foot, it really hurts. Whereas the rice or beans and things, and, you know, and especially for some of our older folks, it actually could cause an injury. So we want to be safe, but using some things around the house, you know, you don't have to spend a lot of money. Using your own body weight as resistance, doing, you know, let's say doing a push-up, or a lot of us can't do push-ups, so do a wall push-up where you're standing and you press your arms against the wall and kind of lean in, you know, and come back out, something that's modified. So all of those kind of things would be strengthening.
Yeah. And then too, I saw on YouTube, I was looking at chair yoga. I saw that I had, so if you're not familiar with that, you know, Google that and see chair yoga. That's something that was really, it was like interesting to me. I thought about the different movements and things that you could do that if you couldn't get up and move around, but you can sit in a chair. And I mean, 10 minutes of that, I was tired when I was finished. I was like, wow. And I stayed in my
Yeah.
chair the whole time.
Yeah.
I don't want us to run out of time. So why don't we move more? Just Angie, why don't we move more?
I want to say excuses, but I won't say that. But we'll call it barriers to moving more. We may not have time. Okay. We may not have time or think we don't have time. It may be, you know, a lack of energy or just not being motivated, or we think, okay, I have this pain or these health problems and I can't. Like, I've met people with COPD, which interferes with the breathing, and they say, well, I can't exercise. But pulmonary rehab can work with those folks and teach them to exercise safely. So, or even if someone is, you know, disabled and they can only sit, like you said, you can do seated exercises. So everybody can do something. So the key is making it a priority, realizing the benefits for your health, and committing to it. You know, there's really, if it was important enough, we would make time. If I said, you know, you have to be on the walking track at 10 o'clock every day, I'm going to give away $100. There'd be a bunch of people down there on the walking track, right? But we're
going to get ready to go. I'm sorry, but this has been great. So we're going to expect to be moving more. And again, this is Wendy Bridges. I'm your host. We're here on Family Health Matters every Thursday from 3 to 3:30 on Awesome Radio 106.9. So please join us, and join us next week, where we're going to be talking with Maya Pittman, counselor, who's going to be talking about mental health.
This is Awesome Radio.
Partial funding for this program is brought to you by CT Cleaning Service, 919-345-5823. Nationally certified and bonded for COVID cleaning, commercial and residential, and for all general.
I've enjoyed it. Thank you.
Cleaning Service, 919-345-5823. Have a peace of mind that your place of worship, your office building, your home, and your place of work have been nationally certified COVID cleaned, disinfected, and sanitized. 919-345-5823.